Have you ever been sitting there at a doctor's office, waiting, nervous? Well, imagine if you were pregnant for the first time, scared, sitting there, waiting. One can only imagine how scary that would be. What if you knew some communication techniques that the doctors were going to use? Would that calm your fears? Today I'll be talking about pregnant women and how to gain their trust and cooperation in the OBGYN environment by using effective communication techniques. Some of you, this may not matter, but I'm planning on going into the medical field, and therefore, I will have to know these skills. However, one day or previously, you have been there or will be sitting in that patient's shoes, and therefore, these skills could come in handy for you to know. I will be on both ends, because one day I'll have a family of my own, and I'll need to know these skills, because I want to trust my doctor. And one day, I'll also be in the medical field, where I'll be sitting there, having to be the other side, and having the patient trust me. So today, I'm going to talk to you about some basic principles of communication skills in the OBGYN offices, the non-judgmental technique, and the technique of PACE, prevention, awareness, choices, and education. First, I'll talk to you about the basic principles of communication in the OBGYN office. On the Knowledge Exchange website, I found an article that is written about a therapeutic relationship dealing with communication skills that was copyrighted in 2009. Skills such as asking open-ended questions, inviting women to share their point of view, showing empathy through engaging and reflective listening, and clean language. This is going to help build a barrier of trust between the doctor and the patient. There are also other ways. On the Integrated Comprehensive Clinical and Communication Skills approach for patient interviews and OSCE exams, there's an article titled, "What is Communication Skills?" that was currently copyrighted at the end of 2014. This includes verbal and nonverbal communication skills. Verbal communication skills are such as good oral communication and stuff that involves eye-to-eye contact to where you can see and hear them. Nonverbal includes your tone of voice, body language, facial expressions, things that aren't necessarily said from your mouth, but if they are on the other end of a phone, they can still kind of understand or feel some vibe from you. Now that I've talked about the basic skills, then I'm going to discuss the non-judgmental technique. The non-judgmental technique was found on the Knowledge Exchange website, which was previously stated. It talks about how if you come into an office, then the doctor is not supposed to be judgmental of you. There are certain areas that this is important, especially if you're in an OBGYN environment. People come in there all the time with interracial marriages that aren't working. A woman could come in and not have knowing who the father is, or not want the father in there, or she could be coming in and want an abortion. These are all different examples that could include the non-judgmental approach. The doctor is supposed to be good enough to where they're not supposed to put their beliefs or feelings in the mix. They're just supposed to take care of their patient no matter what the case. Now that I've talked about the non-judgmental approach, I'm going to talk about PACE, prevention, awareness, choices, and education. On the Best Start website, there's an article called Keys to a Successful Alcohol and Pregnancy Communication Campaign, which was written in 2003. This is where they came up with PACE. Prevention is where you need to include your patient and tell her, be aware of what is going to happen. Awareness is when you also aware them of the differences that it will make in a pregnancy with alcohol and non-alcohol, because different things will happen not only to the mother, but to the baby as well. Choices. You need to verbally communicate with them about their choices that they will make in their pregnancy, because if they choose alcohol, they're probably going to choose a baby that will possibly have something wrong with them. And education. You need to educate them to show what will and will not happen. These are all important aspects in pregnancy, especially dealing with someone who enjoys drinking alcohol on the daily. Now, these things may not be any of importance to you, but I've showed you 3 things that are important. The basic principles of communication in the OBGYN office, the non-judgmental approach technique, and the technique of PACE. These things, hopefully, will help you be better aware of what is going to happen when you possibly are in the shoes of a pregnant woman sitting in the office one day. Hopefully, these skills will teach you and help you to know that the doctor truly does want your best interest and that they are there willing to help you.